Acinic cell carcinoma is a malignant epithelial neoplasm. It is a rare form of cancer that is found in the salivary gland. According to the Acinic Cell Carcinoma Information Center, salivary gland cancers only comprise between 0.03 and 0.09 of all cancers in the United States. There are three major salivary glands on each side of your face: the parotid gland, the sublingual gland, and the submandibular gland. Typically, slow-growing in nature, acinic cell carcinoma is persistent and have the potential for local reoccurrences and even distant metastasis within several years. Acinic cell carcinoma has been identified as the least aggressive of the salivary glands, and a study from the Ohio State University found details that may link people testing positive for the BRCA1 and BRCA2 genes, which are breast cancer and ovarian cancer genes, that it may have a link to salivary gland cancers. Their studies suggest that it occurs 17 times more often in people with inherited mutations than those in the general population. Salivary gland cancers are usually classified in grades. Grade 1 is a low grade and normally have good outcomes. Grade 2 is the moderate grade, and grade 3 is a high grade, which has a low outcome of survival rates. Acinic cell carcinoma is known to start developing a mass in the parotid gland. The parotid gland is the largest of the three glands and runs along both sides of the face into the mouth. The American Cancer Society states that about 7 out of 10 tumors start in the parotid gland. Most are benign, but this is where the malignant ones start. This is the gland that helps secrete saliva to help the digestion process and break down carbohydrates. The submandibular gland is the second smallest out of the three major glands and is located below the jaw. It is a gland that secretes saliva under the tongue. This saliva is important to help create a moisture in your mouth, and it helps with the smooth passageway of anything that a person swallows. The sublingual gland is located under the floor of the mouth. It is the smallest of the three glands, and it is very rare to find tumors here. A tumor found in these glands is more likely to be malignant. Some risk factors could include people who are older in age, radiation exposure, and exposures to certain substances in the workplace. Factors that are found in the workplace are most commonly found in jobs such as plumbing or asbestos mining. Malignant tumors are less common and are characterized by rapid growth or sudden growth spurt. They are firm, nodular, and can be fixed to adjacent tissue, often with poorly defined periphery. Pain and neural involvement are common. Eventually, the overlying skin or mucosa may become ulcerated or adjacent tissues may become invaded. Malignant tumors may invade nerves, causing localized or regional pain, numbness, or a loss of motor function. Cancer.gov says, with acinic cell carcinoma, pain is a symptom found in more than 33% of patients. At this point in time, there are no definitive treatments for salivary gland cancers. The Acinic Cell Carcinoma Information Center currently recommends that fast neurons are the first treatment of choice. This treatment provides the best chance for long-term local control of the disease. Another treatment is to surgically remove the mass. And this can be difficult because you have facial nerves running alongside the parotid gland. And if those nerves are affected, it can cause a paralysis in your face or other long-term effects. Another treatment after surgery, more or less, is radiation therapy. This is common to be followed up after the mass is surgically removed. Chemotherapy is known to be ineffective for treatment and is only used for pain. It helps lessen the pain from the effects of the tumor. Long-term effects of the disease include difficulty swallowing, paralysis of the face, numbness, dry mouth, the loss of teeth, loss of speech skills, tumor recurrence, and death. Because this cancer affects the salivary glands, which produce saliva, it can cause a dry mouth. Saliva is very important material to maintain dental health. People with insufficient or abnormal forms of it tend to have more cavities. When a tumor is removed, there is a risk of affecting the facial nerves, and it can cause paralysis or numbness to parts of the face. Tumors are known to reoccur in cases where the mass has not been fully removed or has been metastasized. The rate of reoccurrence is around 35% and can happen even after a span of 20 years. The survival rates of additional surgical treatment are 67% after 20 years, 83% after 10 years, and 90% after only 5 years. Because this is known to be a slower growing cancer, the death rate is at 16%. Most people who suffer from this disease often die from other forms of cancer that were derived from the acinic cell carcinoma. There are no known preventions at this time for this cancer because there's no specific cause. The only way a person can avoid the potential of being diagnosed with acinic cell carcinoma is along the same preventions for other types of cancer. These preventions include a healthy diet and staying away from harmful substances and chemicals known to cause cancer.